channel. Let's today discuss regarding the cerebrospinal fluid. So this is cerebrum, this is spinal cord, and the area in between those spinal cord and cerebrum is the CSF field space, which is also called ventricle. There are 4 ventricles in the brain. First is the lateral ventricle, second is the third ventricle, and the third is fourth ventricle. 2 lateral ventricle, 1 third ventricle, 1 fourth ventricle. These all are filled with CSF, and those CSF are produced from the choroid plexus and the ependymal cell in the lining of the ventricles. This CSF will flow from the lateral ventricle anterior horn to the third ventricle via foramen of Monro, and from the third ventricle to fourth ventricle via the cerebral aqueduct, and from the fourth ventricle to the subarachnoid space via the foramen of Luschka, as it is laterally present. So this is Luschka, and in the midline underneath the cerebellum it enters the subarachnoid space via the foramen of Mazzenti. Then this CSF will go through the subarachnoid space to the arachnoid villi, and they will absorb into the arachnoid villi, and from the arachnoid villi will go to the superior sagittal and the other sagittal sinuses, and it will mix with the blood. Now let's discuss regarding certain properties of the cerebrospinal fluid and some common abnormalities like bacterial meningitis, viral meningitis, and tubercular meningitis. Now first let's discuss about the normal parameter of the cerebrospinal fluid. Normally cerebrospinal fluid cell count is less than 5, out of which mostly are lymphocytes, and gram stain is obviously should be negative. Glucose is around half to 2/3 of plasma value is around 40 to 85. Protein is 15 to 45, and opening pressure is 5 cm to 180 millimeter or 18 cm of H2O. Now the abnormalities in bacterial meningitis or pyogenic meningitis, WBC count is more than 1000 usually. In viral meningitis it is up to 500. In tubercular meningitis it is up to 100. Regarding the differential WBC in cerebrospinal fluid, in bacterial meningitis it is mostly polymorph nuclear or neutrophil, but remember in early stage of bacterial meningitis, if treated, then in the latter part, or if the patient is partially treated or the bacterial meningitis is chronically present, then this polymorph nuclear predominance will be changed and lymphocyte may predominate. Similarly, in tubercular meningitis, it is chronic infection, so lymphocyte will predominate, but if CSF study is done in early stage, then we may get lymphocytic predominant. Not always, we may get neutrophilic predominance. Regarding viral meningitis, it is always predominantly, as the organism is a bacteria, so gram stain may be positive in more than 60% cases, but gram stain is usually negative, and the positivity is very less, maybe due to secondary bacterial infection. Here the common organism is Mycobacterium tuberculosis, but acid-fast bacilli may not be present in all cases, and CV net sensitivity is not that high compared to other conditions of other tubercular sites. Regarding glucose, as there is very high count and very high bacterial load, so glucose will be less in bacterial meningitis, but in tubercular meningitis glucose is less but not that very low level, and gram stain and glucose level is usually normal in viral meningitis. Protein is very high in pyogenic meningitis, and there is very lot polymorph nuclear cells, and opening pressure will be high as there is high amount of inflammation, high amount of protein will be present. In case of tubercular meningitis, protein level may go up to 200 and the opening pressure may go up to 28 centimeter of H2O. But in case of viral meningitis, it is usually not that high in protein quantity, but opening pressure may increase up to 35 centimeter of H2O. Commonest organism for bacterial meningitis is Streptococcus pneumoniae, Neisseria meningitis. These are usually present in adult patient, and in extreme ages like children or neonate, and extreme ages, for example in elderly patient, you may get Listeria infection or Listeria meningitis. For viral, this is enterovirus, and as the name suggests, the tubercular meningitis is due to Mycobacterium tuberculosis. Thank you.